We've completely rewritten the book in terms of what we can do to a patient's knee over the last decade. We have 1,000 patients in our database that have had osteotomies, and they're mainly young people with arthritis.
Professor Wilson and I set up the London Knee Osteotomy Centre, where we've got a group of surgeons from around the world who are leading experts in the area of osteotomy. It is completely focused on looking after patients to preserve their knee.
Before surgery, I was in quite a lot of pain daily. Couldn't run or jog anymore, struggled with fitness.
80% of what we treat is damage to the inside compartment, of what we call the medial compartment of the knee. And that's arthritis, wear and tear arthritis.
I met Adrian, went for x-rays, looked at the x-rays and found that I had pretty much grade 4 arthritis in both knees. I only thought I could have knee replacements. It was a relief to find out there was other options.
A knee osteotomy is a procedure where we realign patients' limbs to be able to load a part of their knee which is healthy. So osteoarthritis typically affects one part of the knee, and an osteotomy simply realigns the limb so that when the patient walks on their knee, they are now walking on a better bit of the knee joint which is in better shape.
Most people are a bit bow-legged. So if you drop a line from the hip down to their ankle, that weight-bearing line goes through the inside of their knee. We use a very precise cutting tool called a precision saw, and we make our cut. There are two main ways of carrying out an osteotomy. An open wedge, opening a space, and that pushes the leg straight, or a closing wedge, which draws the leg towards where the wedge is being taken away. And over the top, we lay a very small but very strong plate, and we move the weight-bearing line from the inside to the middle of the knee, and we offload the damaged area. So an osteotomy is an offloading operation.
It's definitely changed my life already.
Small incision, minimally invasive, quick surgery, quick rehabilitation and quick recovery.
Having 2 girls of the age of 5, I just want to grow up and have a bit of activity with them and be able to chase them around the park if I can.
So if you feel you would benefit from knee osteotomy surgery or would simply like some more information, please feel free to get in touch with one of our team and we'd be delighted to help you.